I now recognize Dr. Joyce from Pennsylvania for 5 minutes of questions.
Thank you for yielding, and thank you to our witness panel for appearing here today. Dr. Redfield, thank you for appearing and discussing these important matters. One of the biggest problems for our country going forward has been the erosion of public trust in our public health authorities, both at a national and at an international level. I believe that the work this committee will do on getting to the bottom of the origins of this virus will be critical in restoring that trust. And to that end, the House of Representatives will be voting on legislation this week requiring that the Director of the National Intelligence Agency to declassify all information relating to the origins of COVID, especially if there is reason to believe that the Wuhan Institute of Virology is the source of this outbreak. Dr. Redfield, how important is this level of transparency to restore trust with the American public?
You know, I've thought about this a lot, of how we're going to get to the answer that you're striving to get to. What is the origin? I don't think that answer is going to come from the scientific community. I think that answer is going to come from the intelligence community. And we need to get the intelligence community, and you all have the way to do that. I'd like to have each of them show what data they have, where they got it, who their informants were, and what their conclusions were. Because as you know, a number of them are on the fence. They don't say yes or no. You got the FBI and the Energy Department, which I have a lot of respect for, because when you look at those two departments, the FBI and the Energy Department have the strongest scientific footprint of any of our intelligence agencies. And I think the way they got to the answers at low probability, moderate probability, is their internal scientists did the science.
So yes or no, do you support the declassification of all information relating to the origins of the COVID virus?
I think declassification is very important. The only caveat that I would say is there are some method and sources issues that I think you guys are going to have to wrestle with to see if they're compromised by some of the declassification.
And I think that the erosion of the trust of the American people needs to be reestablished, and part of that is obtaining.
I agree with you. I agree with you.
I also mentioned that there's a loss of trust on international levels, and I constantly hear that from my constituents back home in Pennsylvania over the issues specifically regarding the World Health Organization. By kowtowing to the Chinese Communist Party, who showed at every step an unwillingness to be honest and transparent about the timing, the severity, and the origins of the outbreak, they badly damaged their reputation. Dr. Metzel, Article 6 of the International Health Regulations requires that the World Health Organization notifies within 24 hours of all events which may constitute a public health emergency of international concern. Do you believe that the Chinese Communist Party complied with this requirement, given the reports that the CCP had identified COVID cases as early as November of 2019?
There can be no doubt whatsoever that the Chinese government violated the IHR.
Do you feel that there's an opportunity from our group, our work here, to reestablish potential trust in the World Health Organization?
Well, that's a separate issue. Certainly in the earliest days of the pandemic, Dr. Tedros, by his own admission, was saying too many nice things about the Chinese government, when the Chinese government was very clearly not providing the WHO the information the WHO was privately asking for. But as I said earlier, Dr. Tedros then was the essential voice after the deeply flawed Chinese International Joint Study in February of 2021. If Dr. Tedros had not spoken up, basically condemning this deeply flawed report and then abolishing the entire this entire group, we would be in a very different situation today.
The CCP was given full veto authority over those included on the investigation team. And coincidentally, the only American accepted was Peter Dask, who is CEO of EcoHealth. Sort of like having the fox in the henhouse. With this information, do you believe that the conclusions of the report can be trusted? And is there a serious conflict by Dasik's inclusion in the investigation team?
So as I've said many times, the entire process was flawed for the joint study, and that was a joint study not originated by the WHO Secretariat, but by the World Health Assembly, which is the governing body of states overseeing the WHO. So this was forced on the WHO. The report of the Chinese International Group, in my view, was so deeply and fundamentally flawed that it's outrageous. But the WHO Secretariat, they were the ones who then, Dr. Tedros rejected the findings, and then the WHO Secretariat abolished that group and established a new group, the Scientific Advisory Group on the Origin of Novel Pathogens. And that group came out with this report that was saying that we have to fully investigate a lab origin, and they called on China to be more cooperative, and China is again stonewalling.
I agree that full investigation of a lab origin is the responsibility of this committee. I thank all of the panel members for being here today, and Mr. Chairman, I yield.